Hello, I'm Gerard Barnes. I'm the Chief Executive and co-founder of Smart TMS. So TMS is an exciting new treatment which has been shown to be very effective for patients, whether they have been failed by other treatments or this is their first encounter with psychiatric treatment. The revolutionary thing about it is that it uses magnetism, not widely used in medicine other than MRIs, and the magnetism changes the brain with minimal side effects, unlike antidepressants, and no engagement required from the patient, unlike talking therapy. It was actually invented in the UK, but it is much more widely used in other countries like the US, Germany, and Japan. We're just playing catch up in this country with this exciting new treatment. Works by placing an electromagnet, which looks like this, gently on a specific area of your head. When this is turned on, it creates a pulsing magnetic field about this size, which in turn stimulates a small area of your brain. This stimulation, when done often enough, gets all the interconnected circuits going again, allowing the brain to reset from, say, depression back to a normal state. The area of the brain that is targeted varies by condition and is based on extensive research and clinical experience. In the case of depression, it's the dorsolateral prefrontal cortex here. This area has been shown to control concentration, planning, mood, and motivation, all of those things which are negatively affected by depression. So it makes sense, doesn't it, that stimulating this area will help reset the brain to, help the brain to reset itself. So TMS works by causing neuroplasticity, a word used to describe the brain changing, which it does all the time. For instance, when you learn a new skill, learn a language, lay down memories. TMS can be used to treat a seemingly possibly wide range of conditions, but this is because we can target different areas of the brain by putting the coil in different places. So there are a long list of conditions we treat. For depression, we treat here. For anxiety, we treat here. For OCD, we treat up here. PTSD, borderline personality disorder, addictions, insomnia, and even fibromyalgia is the complete range that we treat currently. There are lots of benefits, but perhaps the most important of these is that treatment can work for patients who have tried everything else that psychiatry has to offer. And it's quick. So TMS can get patients better in a couple of weeks. Another important benefit is that the recovery you get with TMS is completely different to that seen with antidepressants. We see patients regain their zest for life. They start feeling things again. Happiness and sadness, which is much better than just being numbed by drugs. Another benefit is the safety of the treatment. The side effects are very mild. Some patients experience a headache, scalp irritation, and tiredness, but all of these reverse soon after treatment. And that compares, really favorably with antidepressants, where the list of side effects includes weight gain, loss of libido, anxiety, etc. So you can see how safe the treatment is. And then the final benefit, I think, is that this is an outpatient procedure. Patients come into the clinic in their lunch hour, for instance, and go back to work afterwards. You can operate heavy machinery or fly a plane immediately after having TMS, which is not something you can say about some other treatments. Okay, so yes, the first thing that will happen when you come in for treatment is that you will be measured for your TMS cap. The TMS cap looks like this. It's just a fabric cap, and we mark it up to show exactly where the coil will be placed. So here you can see some markings, I hope. Then you will have your motor threshold measured, which allows us to give you the correct amount of magnetism for your brain. Once this has been done, we're ready to start the treatment. A normal session of treatment involves the patient sitting still in the chair, which you might be able to see behind me, and then Practitioner will carefully place the coil on your head in the exactly right position, and when you are comfortable, set the machine running. During the session, you can chat with the practitioner, take advantage of their psychological support experience, read, listen to music, sleep. It's entirely up to you, and it won't make a difference to the outcome of the treatment. A typical session is half an hour, but a full course of treatment is 30 sessions. Sessions are usually scheduled daily, but patients can have multiple sessions per day if that fits better with their other commitments. The quickest we can do a full course of treatment is about 10 days, 2 weeks, but you would, in that case, obviously be in clinic for several hours a day. Most patients have one session a day, and the full treatment lasts 6 weeks.